Hello and welcome to Discover LC's third stream of the day. Now we've been covering loads of subjects today. So we have performing arts this morning, then music, then launchpad, then travel and tourism, and now we're on to childcare, health and social care, and science. So lots of things to cover during this live stream. So any questions you have throughout the live stream, do pop them in the comments because we've got a bunch of tutors from all over health and social care and science to answer all of your questions. So do pop them in the comments. But before we get on to the questions, let me introduce you to our wonderful team. First up, I want to introduce you to Kathy. Hiya, Kathy.
Hello, how are you?
Not too bad, thank you. Not too bad. How are you?
I'm fine, thank you. So I'm Kathy Woodham and I'm the Programme Lead for Health and Social Care. Currently I'm looking after year 2, so after this year they'll start flying off to university.
Amazing, cool. Thank you, Kathy. And next up we have Keely. Hiya, Keely.
Hi, Ashton. How are you?
I'm all right, thank you.
Yeah. So I'm Keely Crow. I'm Programme Lead for Level 2 Health and Social Care at the college. Been teaching for 12 years from Level 2 up to degree level.
Fantastic, cool. And next up we have Sharon. Hiya, Sharon.
Hello everybody. Okay, so I'm another Programme Lead for Level 3. My students who are now just going to university, apprenticeships or work, and I will be having the first years.
Fantastic, cool. And last but not least, we have Malk, who is not in a bathroom, is actually in a very nice room that's not a bathroom.
Thank you. Hi there. My name is Mark Merrifield. I'm the Programme Lead for Science. I teach biology on the course amongst a couple of other subjects. Welcome aboard.
Fantastic, cool. So like I said, if you have any questions about any of the subjects, do pop them in the comments and we'll answer them as we go. But beforehand, I've prepared some questions to ask, just in case anyone is a little bit too shy to ask any questions. Don't worry, I've got your back. The first thing I'd just sort of like to know really is, what kind of thing can students expect to be taught on the courses? What kind of subjects will they cover?
Okay, well, I'm quite happy to take this one, if you want me to take this one. Okay, so in the first year, they will do 2 exam units. One is Unit 1, so they'll learn about human lifespan development from pregnancy through to the elderly. And the second unit, another exam unit, is working in health and social care, so roles and responsibilities, organisations, legislation and policies and procedures. So they're just 2 of the exam units that they will do. And those units then continue into the second year for another 2 exam units. So on average, about a quarter of the qualification is based on examined units.
Fantastic. Does anyone? Yeah, Kathy, go for it.
Yeah, I was just going to jump in. Some of the units that my first year is now going into second year we'll be looking at, we're looking at mental health and wellbeing, dementia care. We're looking at working with people with additional needs. We're public health and how that matters and how that impacts the environment and our service users, and what the role of the professional is within those environments. So it's quite a broad area that we look at, and we link into what are the national and government interests and statistics at the time. So we change our units depending on what the government initiatives are.
Fantastic. So it's a very sort of changing course. Every year you can expect something different. Cool. Keely, did you have anything to add about the Level 2 course?
Yes, so Level 2 is 1-year course, 7 units, all internally assessed. We look at human growth and development, communication skills, mental health and wellbeing, creative activities, and things like equality, diversity and working in the sector as well. So very diverse course, quite a fun course to do as well. So hopefully people enjoy it.
Does that change as well with the government changes as well? Is that a bit changeable like the Level 3 courses as well?
Yes, so it does keep up to date with the sector as well and all the legislation, policies and procedures.
Fantastic, cool. Mark, was that about the science course?
Yeah, so across the 2 years you'll be studying chemistry, physics, biology and some maths. The chemistry looks at organic and inorganic chemistry, following a very similar pathway to A-levels. The physics looks at the use of radio waves predominantly, and also in the second year a specialist unit for medical physics if people are looking to go on towards radiography. The biology, we look at human body systems, and we also study a little bit more specialist areas, things such as genetics and microbiology, and this year we're taking on a new unit which is called diseases and infections. I think quite appropriate for the time.
Yeah, very appropriate. So with this course, I know that Sharon, you mentioned that there's 2 exam modules. Are those sit-down exams, in a hall, or are they coursework based?
No, they are. They're sit-down exams. So in the first year, they're both an hour and a half. And then when they go into the second year, they do anatomy and physiology. Again, that is an hour and a half. But the research one, that's 3 hours. And they do prepare all their notes beforehand. They have 6 hours of study and then another 11 hours of independent study. But that is the longest exam that they have. So we do prepare them well for the research exam, which is done in the second year. So.
Cool. And is there exams on the level 2 as well, Keely?
No, good news, no exams or coursework.
Perfect, amazing. Malk, what about on the science course?
Yeah, sadly, exams. So there's 2 key exams in the first year. One looks at chemistry, physics, and biology, and another one is based on a practical. And in the second year, again, exams based on physics, chemistry, biology. And then there's a generic one where, very similar to what Sharon just said, students do a lot of research first and then sit a 2.5-hour exam afterwards.
Fantastic, thank you. So a lot of the courses are quite sort of practical based at Leicester College, being BTEC of vocational learning. What is the practical work to written work balance like with your courses?
It's varied. We try and add in as much practical elements as possible. And some units lend themselves better to the practical elements, such as infection prevention and control. So we take you through how to maintain a safe environment for your service user. You'll learn how to keep your hands clean, which is good for today. You will learn how to take swabs off patients, making sure that you don't contaminate that swab. In the food and nutrition units that we have done this year, they've made food and we've done smoothies and we've looked at the nutritional content within that and how that applies to your service user. Within all of our classrooms, it's never a sit down and just do nothing or just listen to your tutor. We actually ask you to be part of that lesson and you're actively learning. So you'll be up and moving around your classroom, you'll be working with groups, you'll be working in your pairs, you'll come up to the board. So it's not just the tutor standing and lecturing at you. It is your classroom and it is your learning experience. So we expect you to participate in that.
Fantastic. Anyone have anything to add in terms of the health and social care side of things?
They do it as well as their work experience unit. So again, very important as today for the hand hygiene, food safety, moving and handling, and all of this, as well as doing that as part of their work experience. They can do that within the classroom. So we do have those activities that do run alongside their work experience unit as well.
Fantastic. And Malk?
The majority of the work they'll do with us is lab-based, especially for chemistry and physics. I'd say certainly anywhere between 70 to 90% of the work they will do is based on carry out practicals, which help them then to understand the assignment work that follows. It's a little bit less in the biology units, but certainly microbiology, again, that's a very high practical-based unit. So that all the time they're learning lab skills and useful skills should they want to go to university or to the world of work.
Fantastic, thank you. So speaking of sort of world of work and progression, what careers can students sort of expect to go into after they finish these courses?
Well, there's a variety of courses that they can go into. So they can go into university if they wish to, apprenticeships or into work-based practice as well. A lot of them will want to be in some sort of nursing, whether that's child nursing, midwifery, adult or general nursing. We have social workers, psychologists, criminologists. That's just a few of them really. Some of them go into care work. So it is so big, things such as podiatry, radiography, ODP, so where they can work as a theatre nurse. So with health and social care, it is so broad, even primary school teaching. I don't know whether you can add any more to that, Kathy?
No, I'll just agree with you. It's very diverse. I had somebody who went in to do zoo biology. I have people who go into the criminology and the law side of it as well, working with oncology and radiology. So it's really, the world is your oyster. This is an amazing course to be part of and can take you down very different paths and one that you perhaps hadn't thought about.
Fantastic. So it isn't just, setting you up for going into the health or healthcare or social care sectors. Loads you can do with it, which is fantastic.
That's right. Yeah.
Malk, would you like to add about your course?
Yeah, a very, very similar aspect. You can go on to pretty much anything you want to do, especially with the science qual. A lot of universities now run a foundation year in medicine, which means if you want to go on to study to become a doctor, you've got a very good chance now if you do the BTEC science. You can also go on to pharmacy courses now, which is another good change. But other than that, pretty much any sort of science-based course you want to go to, you can get into. It's really good.
Fantastic. My little sister did applied science BTEC at not at this college where I'm from, and she's gone on to do zoology at university. So she's really excited about that. Doing all things conservationist and diving into places, which is really interesting. So you were talking a little bit about work experience a little bit earlier on, Sharon. But what kind of work experience placements will students go on during their time with you?
Well, majority of them would probably go into care homes. They can't go into nurseries or primary or secondary school unless they're special needs. Mm-hmm. I know Jodie works a lot with our placements, and this year we've had some excellent ones to go into mental health, which was supported by Kathy, and that was at Arnold Lodge. And I've had 4 of my second year students went into Arnold Lodge and supported within that unit. And from that now I've got one that's applied to the Bradgate unit up here at Glenfield, and others as well have gone and applied to become bank staff at Arnold Lodge. So anything really from mental health, special needs, they go into occupational therapy, the MS Therapy Centre, into youth work. Not very often into nursing at the moment because they have to be 18 and over. Many go into care homes or your special needs school as well.
Cool. Keely, do they get a work experience placement on the level 2 course, or is it just the level 3?
No, they get it on level 2 as well, and they'll go to similar settings as well. So care homes, some like to do pharmacies, day centres, pretty much the same as well as what Sharon said. So they get that opportunity too.
Cool. And Malk, is there any work experience placement opportunities on your course?
Yeah, same as with the health and social care. But Jodie's done a fantastic job. She's forged links with Leicester University, amongst others. And in those cases, students get to work in the labs alongside PhD students, which can only broaden their knowledge and really help them sort of to move forward when they choose to move on from college.
Amazing. Obviously, Leicester Uni is currently at the forefront of a lot of the COVID-19 research. So that's an amazing place to go and get some placement opportunities. So how often are students in college? Is it every day? Is there a certain amount of hours they're expected to be in per week?
Yeah, sorry, you go.
Sharon, yeah. 3 days in college, 1 to 2 days in placement, depending on how fast you want to get the placement done. Those days vary. You'll have a timetable that's set for the year, which will hopefully then follow into your second year. So it could be Monday, Tuesday, Wednesday, Thursday, Friday. It could be Monday, Wednesday, Friday. Because we have 4 or 5 groups per cohort, it's like a jigsaw puzzle, so we have to fit it in, and we have to work alongside our placement providers to ensure that students have a positive experience, and actually that the placement provider is not overrun with students, because obviously their forefront, their priority is their service user, so we don't want to overwhelm placements with hundreds of students that then take the time away from the professionals who are working with that service user.
Fantastic, thank you. Anyone have anything to add to that? Or no? All good. Cool.
Yeah, just I'll base a little bit more compared to Kath. We still do the 3 days a week, but we don't have the same amount of placements that Kathy's students would have to do. So our students are in 3 days and they'll be fixed throughout the time at the college.
Fantastic, cool. We've had some questions from Facebook, so I'll get those ones up first. Grace asked, do you have to go to university after taking part in the level 3 childcare if you want to work in a foundation stage at primary school?
This is childcare, not health and social care, though, so I'm going to struggle. They can go on to university to become a primary school teacher with health and social care, but yeah, they would have to go to university to do that.
Yeah, so even if it was health and social care, they could still go and do the university degree and then become a primary school.
Primary school teachers, yes, I've had students that have successfully done that.
But they do have to go to university. Yeah, you do have to go to university.
Yes, they do. Yes.
Cool. And then we've had a question from Leanne saying, I'd like to be, and I'm going to try and pronounce this, but I don't think I'm going to do a very good job. A chiropodist. Nice, thank you.
Yes.
Will there be opportunities for this?
So yes, it can go into podiatry. So again, into feet. So yeah, being a chiropodist is something that you can work towards with health and social care.
Fantastic, a chiropodist. We learn new words every day.
Very well.
Yeah, thank you very much.
I'll add to that one as well. One of the students has recently become well known throughout in Leicester and actually in London. He's known as the podiatrist. If you search for him online, I won't embarrass him by telling his name, but he's actually a former student who's done the level 3 science course.
Cool, perfect. So you've got quite a few options there if you want to be. One more time, Sharon, because I've forgotten already.
Chiropodist.
A chiropodist. Thank you. Cool. So the next question, obviously, a lot of courses have required things you need to buy before you start the courses. Do the health and social care course and the science course have any kit or a kit list that students need to buy before they start?
I'm quite happy to answer that one. No, not for health and social care. The only thing that you will buy as part of your kit would be a t-shirt, which we will help you buy, because when you go into placement, you are a student. You're not a qualified member of staff. So staff members and service users need to know that you're a student and that you're not going to do certain aspects of their care because you're not qualified to do that. But other than that, no, it's your pens and paper, anything else that you would use in the classroom. There's nothing specific.
They will need a textbook though.
A textbook?
Yeah, their first year textbook, which will have their units in and support them. But as we're teaching anyway, we always provide them with PDFs and useful handouts that they can use, which will help with their studies as well. And that won't cost them any extra.
Fantastic. And Malk, is it the same? You don't need any specific kit for the course?
No, we will be supplying lab coat and protective goggles for the students this year, as we've done in previous years. So yeah.
Fantastic, cool. Will students be able to resit GCSEs alongside your courses?
They can maths, yeah. If they needed maths, then yes, we can put that alongside their timetable. The only problem with that, though, then it will add to their time in college as well. So if they're doing their 3 days of the course, then they'll have to factor in that they've got maths to do as well.
Cool. Can they resit it alongside the science course as well, Mel?
Yeah, ideally we'd like the students to already have the maths and English GCSEs when they come on board, but if they're missing one of them, then we can look at putting them onto the relevant GCSE.
Fantastic, cool. Are students able to go straight into a level 3 from leaving their GCSEs, or do they do the level 2 first and then move into the level 3?
No, they don't have to. They don't have to have any prior knowledge of health and social care. As long as they've got the GCSE onto the course, they can go straight to level 3.
Fantastic. That's the same for science as well, Malk?
No, ideally we'd like them to have a good GCSE background. So we're looking at a grade 4 in GCSE. It can be the double science or it can be individual sciences, but we need that with the GCSE maths and English as well.
Fantastic. That was my next question, so I'll just skip that because you do need science to get onto the science course. That is correct, isn't it? Yeah. Cool. So we mentioned a little bit about sort of the university, but going on for it. But these courses all allow students to go into university. Obviously, some unis don't accept BTECs. They're a little bit funny about it, but most universities will accept students with a BTEC, won't they?
Yes.
Yeah.
Yeah.
Okay.
Yeah. We've never had any problems. None of my students have problems with being a BTEC student and getting into university. And as Mark has had, I've had a student that's gone into medicine from her nursing, so she did a PhD. So you can get straight in with no issue whatsoever.
Fantastic, cool.
I was going to say, we had feedback from a previous student. She went to study physiotherapy in Cardiff, and one of her lecturers said she's actually the best student in her group, because she knows how to research and write essays compared to some of the A-level students. So I think the BTEC is a good preparation for university.
Fantastic, thank you. So what campus will students be based at on your courses? Is it just the one campus, or is there a sort of coverage of 3?
It's just the one campus at Abbey Park.
Perfect. That's the same with science as well, Mark?
Yes, it is, yeah.
Cool, perfect. So last couple of questions that we're sort of coming on to now. So do feel free to put any questions in the comments now while we're finishing up, and we'll try and get to them before we round everything off. But what are the entry requirements for your courses?
Okay, so for level 3, it's 5 GCSEs and above. They must have English, but if they are struggling with maths, then we can help them with a maths GCSE.
Fantastic. Malc?
Ideally, a grade 4 maths and English and grade 4 in science. And we're looking for a total of 5 GCSE.
Fab. And Keely, for the level 2, what are the entry requirements?
For level 2, they need a grade 3 in maths and a grade 3 in English language and a good reference and attendance record.
Fantastic. So we've just had another question from Hannah. It is about childcare, but I assume it's sort of will be able to be answered by you guys as well. It's, do I need to find my own placement for childcare before I start college?
No, the childcare team will find you a placement. Within the childcare course, there are specific hours you have to do in specific placements, and it's all uniquely timetabled by the college, so you don't need to worry about that.
Fab, thank you. So the last couple of questions I have, will students have to come for an interview before they start the course, or is it just the application form?
No, they don't have to come for an interview. Well, before the lockdown, we had welcome events. The welcome events then would tell the students all about the course and the expectations and the qualifications, and then the students then would apply to the course.
Fab. Is there an interview for science, Mark?
Exactly the same situation.
Fab, cool. So last couple of questions now. How do students go about applying for your courses?
The application online you can do, and they'll take you through to the information centre. So just look us up online and apply through there.
Fantastic. And that's the same for science as well. Just apply online, have a look on the website.
Yeah, strangely enough, it's exactly the same. Course code C6321.
Perfect, cool. That's a nice, easy one. Fab, so that's all the questions I have for you. We did get a question about doing a live stream about childcare. Unfortunately, we were meant to have someone from Childcare on this live stream, but they had some technical issues, so they won't be on this one. But any childcare questions you have, do feel free to comment them below, and we'll try and find those answers out for you. But so before we wrap things up, I just want to get a little bit of tidbit of wisdom from you all, or a little bit of advice for students who are coming in September. Anything you'd say, best way to prepare to start the courses, or anything they can start doing to get themselves ready to start with us in September?
I would say to just do a little bit of research about the units and the expectations of the course, maybe to just, if they've not got any prior knowledge of health and social care, so that they just sort of have a brief understanding of maybe some of the units that we deliver and the expectations really of being at Leicester College and studying with us.
Fab. Anyone else?
I would just say be open-minded, be ready for a challenge, and enjoy yourself.
Very nice. We like that. Malc, any words of wisdom from yourself?
I would just recommend students just keep looking at what's going on in the news at the moment, and certainly keep themselves interested in everything. Go back over the GCSE books, get ready for the next level. It's going to be a challenge.
Fab. And Keely, anything you'd like to say as well?
Yeah, just like Papa said, be open-minded, but also come willing to learn and be enthusiastic to enjoy it. It's going to be a whole new experience for all of us. So yeah, we look forward to seeing you.
Fantastic. And last question, just before we round up, just had one come through on Facebook. It just says, I'm a carer. Will that help with this course?
Yeah, I can answer that. Yes, of course it will. We expect you to use all of your own experiences and apply that into the classroom. You'll have a little bit more experience than other people, and we would want you to share that, your experiences, how you think the theory applies to where you're working. All of us who teach on the course come from a specific background, and we use that background to make the lessons come alive. It's not just theory, it's about what happens in that workplace. And yes, it'd be lovely to have somebody on the course who is already in that environment and experiencing what's happening today, actually, because it's very different from what we've had before.
Fantastic, cool. So we've also had another question come in just as we were trying to wrap things up, but that's all right. We'll stick around for another couple of minutes. Brooke has asked, is it worth bringing any previous notes or textbooks from secondary on the first day of health and social care?
I would say no. I would obviously keep hold of them because the notes and the textbooks will probably come in handy if you're doing different units and they relate to the different units. So just keep hold of them because they might help you. They might help you when we're doing group work or discussions, activities that we're doing, and also to share what you've learned as well.
Fantastic. Another question from Alan. Now, this one is about childcare, but I think the answer would be the same for health and social care as well. But what level of English should she have for starting level 1 childcare?
I think it'd be a bit tricky because we don't do level 1. So I would assume it would be a grade 2, grade 1, grade 2. But I'll definitely check with the childcare staff.
Cool. Perfect. Well, that's all the questions we have. So if that question, Anna, if you want to send that to us on a DM, we'll try and find that out for you. But that's all the time we have. But thank you guys so much for joining me. It's been really useful for everyone watching at home. If you are watching or you think of a question after the stream's finished, or maybe you've come back and watched the stream again and you think of another question, just pop us in a DM or comment on any of our posts and we'll try and find that answer out for you. But for now, we'll wrap things up and hopefully we'll see you all in September. But thank you guys so much for joining me. I hope this has been a bit of a stressless time for you. I know it's a bit daunting doing things like this, but thank you guys so much for joining us. Thank you for watching, and we'll see you as close to September as possible. So see you later.
Bye.
Thank you. Bye.